I talked about what I was going to go into a little. What's the benefit when somebody gets a stem cell transplant? And I think you kind of said that a little. It replaces your whole immune system and starts it over. It's almost like a rebirth, kind of.
Yeah. So, the number one benefit is we try to achieve a cure. There's a goal of treatment, and we are very ambitious. We want to cure the patient. And with the goal of cure, then sometimes we count on a big dose of chemotherapy, and sometimes we count on the new immune system. We can reset the clock of the immune system, and we also can use the new immune system to prevent the cancer from coming back, in particular blood cancer.
Okay, and some of the common risk and side effects, like we talked about infection, and you mentioned graft versus host, and disease. When you talk about that, maybe you can explain a little what you mean with that.
So we're talking about the immune system. Immune system is fighting for infections. Infections could be a bacteria, could be a fungus, could be a virus. And after giving high dose chemotherapy, then try to get rid of the cancer cells, and also maybe radiation, including total body radiation. Then the immune system will be going down to almost zero. At this time, these infections may be taking over. And sometimes we may lose our patient because of severe infections. It was a big problem in the past, but now we are doing a much better job. The most important thing is prevention is better than cure. We have all different good drugs to prevent the infections from happening, and also have a good transplant program. They will have a very good experience in handling it, preventing it, and we have the trained nurses and doctors, a whole team. The most important thing is the whole medical team and taking care of our patients in a multidisciplinary approach. And this will prevent infection, treat infection, identify the infection aggressively, and prevent this from becoming a severe side effects.
Right. Even when Scott had he went through his chemotherapy for his lymphoma, I administered shots with Neupogen, and it boosted up his white count cells, so he didn't get any infections. So, I mean, I guess 10 years ago they didn't really have that kind of therapy to help you get along with chemotherapy.
So I started doing bone marrow transplant back in 1987. It was my first transplant at that time. The patient at that time stayed in the hospital for approximately 3 months. And nowadays, with a autologous stem cell transplant at Rush, the average length of stay in the hospital is approximately 2 weeks only. Wow. These are because of the advancing medicine. In particular, we have better antibiotics, and also we have better growth factors. One of them is called Neupogen, and in particular because of the way that we collect true stem cells. And these stem cells work much faster, and they are very intelligent cells and rapidly build up the immune system. Of course, you have to have good doctors,
yes,
like me.
Yes, yes. And now here's a two-part question I have for you. Who is a good candidate for stem cell transplants? And again, we had before, many years ago, probably somebody elderly, 60 or older, which isn't really elder, but wouldn't be a good candidate for stem cell transplants years ago. But nowadays, who would you say is a good candidate?
And I'm a transplant doctor, so maybe I have some bias, but to me, every single patient with blood cancer is a potential candidate for stem cell transplant. They may benefit from stem cell transplant during the course of disease. But the other way around is not every patient with blood cancer will require a stem cell transplant. But it is important, very important, to connect with a transplant doctor during the early course of the disease. Although I'm a transplant doctor, I'm not going to transplant everyone. So who will benefit then? The patient that has at high risk of recurrent disease despite chemotherapy or immunotherapy, then they are potential transplant candidate. Or the conventional chemotherapy or immunotherapy doesn't work, then they are transplant candidate. When we're talking about these potential transplant candidate, and in the past, like 20 years ago, we would say 50 years old is the upper age limit. And then over the past 2 decades, we changed it to 51, 52. Every year we increase one more year. And now, in particular, some of the patients, they will not have any other option, and transplant is a curative option. There should not be an upper age limit at all. And also, age by itself is only accounting using your fingers and your toes. What is important is what we call physiological age. Some patients only 40 years old, they are beaten up already, but some patients that are 79 years old, then they can look very fit and really don't have any other comorbid condition. That means they really get good health until they have a blood cancer. The oldest patient that Rush has transplanted, she was a 79 years old lady. We transplanted 4 years ago. And she's now 83 years old, in remission, doing very well. And she has 19 great grandkids. And it's wonderful. She comes to see us every few months, and she loves to put on her lipstick. And I just tease her sometimes that she must have learned it from Sarah Palin.
Well, I can't say I like lipstick myself too, as you can see, Dr. Fung. So, but that's good because years ago, like we said, somebody in their 60s or even 80 couldn't get a transplant, but now they can. So with all the advances that we've had, when someone gets a stem cell transplant, will they have to get in, and this is maybe something from the past too, which I wanted you to kind of explain, will they have to get another one and say down 10 years, or do they last forever, or how do you, is it just like recurrence, or how do you measure that?
It depends on different disease and how the response. Many of them, in fact, only need one transplant, then will achieve a cure, and then they can forget about the blood cancer. And in particular, some aggressive types of lymphoma, if they don't come back within 1 or 2 years, they will never come back again, similar to in leukemia. But some of them, like myeloma, that unfortunately transplant may not cure the blood cancer, but then they will control the disease, and sometimes we do one time, a few years later we'll do another one.
Okay. I believe we have a caller on the line. Bill, can you hear me?
Yes.
Hi, did you have a question for Dr.
Thank you for taking my call. Quick question. I was going to ask about stem cells. Will stem cells benefit other conditions in the body outside of those conditions that the stem cells are generally being transplanted to correct? I mean, if you got other underlying minor,
you mean like
other degenerative type diseases.
Yeah, you mean something besides a cancer? Is that what you're saying? Yes. Okay, that's what. Yeah, he's asking, and again, it's good question. Very good question.
Very good questions. Overall, stem cell research is rapidly evolving, and when the bone marrow fails, in fact, it's the bone marrow failure syndromes, and we use bone marrow transplant to new stem cell to replace the failed bone marrow. And we also at Rush we have studies for patients with severe heart failure. And it's also looking at regenerations for joint disease and also the bone disease and other like eyes, and that's a rapidly evolving field. In the future, for degeneration may be one of the options for patients. Okay.
Yeah, and again, it's the field is open. And I want to thank you today, Dr. Fung, and again, my friend Henry.
Thank you very much.
So thank you for coming, and we're gonna bring Scott back for a moment.
Thank you so much.
We wanted to go and talk about too. If you want to reach us, you can get Chicago Blood Cancer Foundation, www.chicagobloodcancer.org. And our phone number is 888-792-9992.
Well, this has been another fantastic Battling and Beating Cancer show. They're usually better, if you can tell, when I'm sitting on the sidelines. And Dr. Fung does remarkable work. And stem cells, as you all know from the news, is just a phenomenal area to help people really across the board, and particularly for blood cancer patients. It's very important that you consider it. Now, we're going to continue in this vein of selecting, we don't just tell you select the best doctors. In the past episodes and in future episodes, we put the best doctors on the air so you can get to know them a little bit, get to really appreciate what great doctors that we have here in Chicago, and to appreciate the fact that you don't just need a doctor that knows their books and who knows the technical aspects, but doctors who are really warm, caring people. And so next week on Battling and Beating Cancer, we're going to have Dr. Vino Gopal of Rush University Medical Center, and we're going to switch gears a little bit, and we're going to talk about leukemia, signs and symptoms, and treatments. So we'd like to thank, as always, the magnificent Dorothy and Christy for their fabulous job. Thanks to Dr. Henry Fung for a fabulous job of explaining stem cells and stem cell transplantation. And we will be back here next Wednesday night, 7:30, here on CAN TV 21 for Battling and Beating Cancer. Until then, everybody, have a wonderful evening. Good night and good health.
Thank you.